Hi. I don't know if we're live. Let's have a look. Hello, everybody. Right, let's have a look, see if we're going live. We are live. Hi. So, oh my goodness, so much has happened since I last came on live to see you all. And apologies for being away for so long, but needs must. And my family had to come first, as they still do. We are all going through some very tough times, are we not? Lots and lots being brought up for us on a day-to-day basis. And in terms of our mental well-being, I know that there are many people out there who are genuinely struggling when they didn't expect to as well. I mean, come on, the idea of perhaps spending more time at home with your family is a wonderful thing, and for many it is, but for many it also isn't. And it's bringing up all sorts of things from the past for people. It's making them question themselves, their abilities, their capabilities, so much. And a little while ago, I asked the question to this mindful parenting beyond birth group what it was, mostly from the Beyond Birth Guide, that would be useful to talk about right now. And Katie came up with the idea of me talking a little bit more about ambivalence and also acceptance. And I'm really pleased to come on and talk about that at the moment, because we are essentially, sorry about the lighting here, we're essentially going through a very ambivalent time, are we not? And ambivalence is really about being in a state of mind that is sort of in the middle of expectations and reality. It's when you are met with these feelings that are conflicting, thoughts and feelings. So ambivalence is liking it and hating it. Ambivalence is I love you, but I don't like you very much right now. Ambivalence is I love the idea of being at home with my family, but yet I feel like I want to just run a mile. I need a break. Give me a break. Yeah. And where are you with that? Now, what I love about ambivalence is that we usually arrive on one side of the coin or the other when we sit with it for a bit. But most of us, due to society, the way we were brought up, all sorts of things, don't want to be sitting on the dark side. We don't like to be sitting on that side of, I love you, but I hate you right now. Yeah, it doesn't feel comfortable. So what we do is we try to push that down. We try to disguise it. We avoid it. But the true power in managing ambivalence and ambivalent thoughts and feelings is actually to allow that dark side to be there. Yeah. It's like when you feel angry about something, if you quash that anger away, then it will sit and brew. Yeah. If you allow the anger to be there, or to let it come out in a healthy or managed way, then it loses its power and it goes a lot quicker. So when you are faced with these ambivalent thoughts and feelings, like for instance in pregnancy, ambivalence comes up so much in pregnancy and parenting. In pregnancy, an ambivalent situation could well be one where you are feeling deep down very afraid about giving birth and thinking, I want to have every drug under the sun. I don't want to feel childbirth because I'm afraid of how it's going to feel, and I don't know if I'm going to manage to cope with that. You know, perhaps you're telling yourself that you have a low pain threshold, perhaps you're listening to stories of other women in your family who've had terrible, terrible births, and you're thinking that's going to be me because I'm quite like them and we're all family, and surely that is my situation. But you see, on the other side of that coin, you perhaps have gone and done a hypnobirthing course, or you've been reading up about natural childbirth, and you are reading all of that information and thinking, but that is how it should be, yeah. And the ambivalence sits there in the, I know that deep down, I know that actually I'm really afraid and I want to just go and have every drug under the sun. But yet on the surface, if I'm doing this the way everybody else is doing this, and, I've got to be brave and I've got to be, strong, and I've got to not be afraid. And therefore I need to book a natural birth. So the ambivalence is lying there of the, what side do I go on? Where should I step next? And so often we need to just sit with that and ask why. So ambivalence can often be overcome when you ask the question, why? Why am I feeling ambivalent about this? Where is this coming from? And so often it's not the ambivalence itself that needs addressing, but all the other elements of that and the reasons why you've arrived in that ambivalent state. Okay? When it comes to parenting, obviously the classic feelings in parenting are, I love this little being very, very much, but it's kept me awake all night and it is so demanding, and I just need a break. I need space. I need to be feeling like I'm doing something for me and not having to continuously think about another thing, another human to keep alive. Those ambivalent feelings are very, very common. That feeling of parents going out to work again and just thinking, but I want to be at home with my family, but I have to be out and I have to be providing. Or I want to be at home with my family, but yet actually I can't bear to be at home with them for long because it's too noisy, it's too stressful, it's too demanding. And actually I enjoy going to work, but I shouldn't be feeling like I'm enjoying going to work, because does that mean I don't care? So this is ambivalence. And this comes up time and time again. And the thing that happens often is that we are afraid to talk about, to voice that dark side. The dark side is somewhere that, especially if you talk to your friends, it's like, what are they going to think of me? Ambivalence, when we talk about it, is often really, really useful exercise to do, but it does tell you a lot about other people. It lays people very bare, open. Okay. And a lot of people don't like to be in that situation, especially if you're in, perhaps a new parents group and you're having a chat about how you're feeling or something's cropped up. And, most people wouldn't dare turn around and say, actually, you know what? I really, really don't like my baby right now. Or some people would never even dream of saying, it all looks like you're all getting on really well with your babies, but I don't think I've ever felt like I really love them yet. What's happened? This is really raw stuff, but it happens all the time. It is the dark side. And the more we learn to embrace that dark side and realize that other people are there with us, they're in it with us, the more we can normalize it. And it helps with the feelings of ambivalence that we get. It helps to normalize that. It takes away the shame. It takes some of the guilt away. Now, that guilt is always going to be there, but helps us to kind of manage it a little bit better when we feel that we're not the only ones, does it not? One of the other ways of dealing with ambivalence is not only to question it and to vocalize it, to rationalize it a little, to ask that question why, perhaps to note it down, to journal it out, to see where the bigger picture is really, but also is the next step is acceptance. So acceptance doesn't mean that you are resigning yourself to something, you're giving in. It can be sometimes, but the majority of the time, acceptance comes from a place of choice. I choose to accept this. Yeah? So think about that for a moment. Choosing to accept that there is a dark side to you in terms of how you think and you feel right now, in whatever situation you're in. You could be watching this right now and being at home and feeling resentful of the fact that, you know, you'd like 10 minutes just to sit and watch this, but you've got other things that you need to be doing. Your baby's crying, you need to cook food, you need to, all of these things. It's all part and parcel of this. Okay, you could be welcoming the fact that you're at home and rejoicing in this beautiful time. Obviously, this time for new parents, this is what we would be getting anyway, this kind of lockdown. So for new parents, it's like, well, this is the best excuse just to have to stay home and bond with baby. Amazing. But also those feelings that crop up of just like, but I need the old me, or I need to be out doing something for myself, or all the stuff that crops up. And it's about sitting with it for a moment and accepting that this is where you're at, accepting that the state that you're in, whatever you're in, good, bad, up, down, left, right, positive, negative, it's actually where you're at right now. And when you practice that level of acceptance, it can help you to see more clearly. It can help you to feel more, interestingly, more in control. And that is essentially what we're all looking for, is it not? The fear that comes from feeling out of control, of the uncertainty that we're in right now, for instance. We're all feeling fearful because we're feeling out of control. We're not sure what's coming next. And that's classic when it comes to having a baby, not knowing exactly how birth is going to go. And we're all sitting at home at the moment waiting for the news to say that we can all go back to our normal lives again, whatever normal looks like, whatever normal is. And so practicing a level of acceptance whereby we're saying where we're at right now is okay. It's not that we're saying we want it, but it's more that we're saying we're seeing this as it is. And whatever comes next, I accept it. And I will manage it in the best way that I possibly can. So when you are feeling hugely ambivalent about a situation, a person perhaps, then accept that ambivalence for what it is. Know that there is a dark side, always. Ask the question why you're feeling it at the time, and then just be a quiet observer to the situation. Allow your mind to be at peace, be more mindful about how you are approaching your day-to-day, and bringing in a little bit of self-compassion in at the end of it all, once you've accepted, bringing it all back to feeling better about you, who you are. What do you need in those moments to help you to feel more balanced, to help you to feel calmer, more at peace, is really the way forward. But at the end of the day, especially now with uncertainty, if you start to try to fight it or to control it, it will only feel worse. And I know that many, many of us are in situations right now where we are very concerned about our livelihoods. We're very concerned about our health, about the health of our loved ones. We're concerned about the future of the world as we know it. But we have no control over that. And as a result of that, that will bring up a lot of mixed thoughts and feelings. And so go with it, sit with it, allow it to be, Recognize the dark side. Don't try and push it away. Don't try to fight it. Just see, be an inquisitive, do a little bit of detective work, ask the whys, and then also ask the likelihood of the worst case scenarios happening in your head as well. See if you can find the seed of reality, the seed of truth in that too. And if you need me at all, I am very available, freeing up more time now. My husband is spaced from home. So I'm going to be available to you more online during the days and the evenings and the weekends. So please, if you want to have a session with me where we can just talk it through, or you can do the talking and I will do the listening, then let's do that. If you would like to have a session whereby I structure it more in terms of formal therapy, hypnotherapy perhaps, with elements of CBT, then we can do that too. If you just need me to be there holding space for you because you don't feel you can open up to anybody else, then that's what I'm there for too. Parenting is hard. It is beautiful and it is hard. And that's the ambivalence in it. We welcome it. It is so joyful. But yet, my goodness me, it's so tough. And there are times when you just think, what on earth is going on here? Why is this bringing out the worst in me? And that's all part and parcel of being a parent and managing. And even if you have all the tricks up your sleeve, like I seem to have managed to gather over the years, when those curveballs hit, they hit. And that's why I've taken time recently to allow my mind and my body to recover from the shock that we had a few weeks ago with my son being in and out of hospital. And my mind went into freeze mode, completely just froze, rabbit in the headlights. And that in itself was ambivalent. It was frustrating, but yet I had to welcome it. Nothing more I could do. Wait and see. And I've pushed through to get to this point today. And my goodness me, my mind was telling me not to do this today. But I'm glad I've done it. I'm glad I'm here. And I'm really glad I'm here for you. So I'm going to stop waffling. Please do write some comments for me. If you can, I love to hear back from you. Even if you don't feel you need my one-to-one help, then just stay in touch and recommend me to your friends. Take care. Really, really glad to be here for you. Oh, thank you very much, William. Yes, he is. He's back to his old antagonistic self. Absolutely. 11-year-old going on 21, believing that he is in charge of the world. And I love that about him. Yeah, thank you for asking. That's really sweet. And I hope you're doing okay too. And you know that I'm here for you too. Please do know that. Okay. Right. I'm off. Take care. Thanks, William. Lots of love to you. Bye for now.